athletes, I wanted to answer a question out there that I've been getting a lot lately, and that is, what are some of the predisposing factors that may put me at higher risk for a knee injury? So today we're going to talk about Q angle, and that's going to be the answer to that question. So you may have never even heard of Q angle, but I bet you've probably heard of, knocked knees or bow legs. So both of those presentations, whether you have knocked knees or bow legs, are going to basically determine your Q angle. So Q angle is pretty much the angle from your patella up to what we call your anterior superior iliac spine. So I call them bikini bones. Some people call them your hip pointer. But if you basically put your hands on your hips, you'll feel this very pointy bone at the top. That's what we call the hip pointer or those bikini bones. Or if you want to be really technical, the ASIS. Now, if you take a line from that hip pointer straight down to your kneecap, that's going to be part of the angle. And then if you take a line that goes straight up from the tibial plateau through the middle, of your kneecap, that creates that angle. So kneecap up, ASIS down, that's what creates the Q angle. So you can imagine that if you had a larger Q angle, maybe because you're a female with wider hips, or maybe you've got some sort of genetic, anomaly where you just have from birth knocked knees, or maybe you never grew out of them. Maybe you've got a muscular imbalance that's causing you to have this presentation, that can put you at more risk for a knee injury. So a larger Q angle, for the most part, pretty much puts a greater stress on the inside of your knee, and that will put you at more risk for having something along the lines of maybe an MCL sprain, maybe a meniscus injury, or maybe even an ACL tear, especially if you're a female. Females, like I said, have a higher incidence of, knee injury due to the larger Q angle, but also because their muscles are not as symmetrical, as well developed or balanced as a male. And so somewhere in that age range of maybe 10 to like 15, 16, if you're a girl and you play soccer, you're at a little bit more of a high risk for a knee injury, especially like an ACL tear. So you're probably thinking, what the heck does, a Q angle or like muscle imbalance have to do with it? Well, I will tell you this. The patella, which is your kneecap, is pretty much, I don't want to say embedded in your quads muscle, but it's pretty much, pretty much it connects to the very distal part of your quad, and then the superior portion, or the very top portion of your inferior patellar tendon. But pretty much that is your quads muscle. So you have your quads coming down the front of your thigh, then you have your kneecap, it wraps over and then attaches down to your shin bone. And so what happens is when you flex and extend your knee, basically that quad will activate, and there's a little groove. So if this is your femur and this is your tibia, and then you've got your patella in through here, there's a groove that it actually slides up and down. So if you have a larger Q angle, what's going to happen is when the quad actually contracts, it's not pulling it straight up and down, it's actually pulling it up and to the side, which can cause some irritation of the knee, maybe cause like anterior or front-sided knee pain. Also, if you have an imbalance between, let's say, the outer part of your quad and the inner part of your quad, it can actually exacerbate this even further. So, muscular imbalances, larger Q angles, those are a couple of things that can basically predispose you to having, some sort of knee injury, or just, nagging chronic knee issues, throughout your life. But, you can do simple things like, mobility training. You can do soft tissue work to alleviate some of the tension in those certain muscle groups, and then strength and conditioning work to actually like balance out those muscle groups so that you have proper tracking of the kneecap. So that's pretty much it, guys. That's what Q angle is. That's how it predisposes you to having some sort of knee injury. Hope you learned something from this video. If you have any questions, feel free to contact me via social media down here in my left-hand corner. If not, have a good one and move free, guys.